Florida Medical Association, helping physicians practice medicine.
Welcome to the Medicine Curated podcast. I'm your host, Tim Stapleton. Our guest today is Dr. Sarvam TerKonda. Dr. TerKonda is a plastic surgeon who practices at the Mayo Clinic in Jacksonville. He's also a member of the Florida Board of Medicine. He serves on the Florida Medical Association's Board of Governors as our liaison to the Board of Medicine, and he is on the Board of Directors of the Federation of State Medical Boards. So we're very pleased to have him join us today. And Dr. TerKonda, thank you so much for giving us a little bit of your time today.
No, Tim, thank you very much. I appreciate this opportunity to speak with you and our members. I think it's so important to get introduced to the members and provide these updates to our fellow physicians. So thank you very much.
You bet. Well, before we jump into the topic, and it's a very interesting topic that we're going to talk about today, why don't you tell us a little bit about yourself? What inspired you to pursue a career in medicine? Where did you go to school? And what was your journey that led you to ultimately settling in Jacksonville and practicing at the Mayo Clinic?
So I probably took the most convoluted approach to med school, but I think, so often our career paths are really shaped by the mentors we meet along the way. I started out in engineering at Case Western Reserve in biomedical engineering, and I had a great mentor who said, hey, you probably need to take this course. And it was actually flow dynamics of the artificial heart. So I had a chance to go to the Cleveland Clinic and work on the Colf artificial heart. And I actually got to see it utilized in a patient. And that's probably when my interest really started in medicine, when I got to see this device actually being used in a actual patient. At that time, I had brothers in med school. I had an older brother in med school and a younger brother in med school. So kind of getting pressure from them and this interest, that's probably what shaped my interest into medicine.
So you had a family of underachievers. That's what you're saying, right?
Yeah, that's what everybody says, As I said, I was the black sheep because I was the last one to go to med school. But I ended up going back home to medical school in Missouri, which is where I grew up at University of Missouri, Columbia. My poor dad had three of us in med school at the same time, so he's paying tuition for three med schools. But that's why I went back to Missouri. And as I was going through my, med school, I did rotations in cardiac surgery. So my whole plan was go into cardiac surgery, and I really liked children. So I was thinking, well, maybe pediatric cardiac surgery would be a great path for me. So when I finished up there, I was fortunate enough to match my residency in general surgery at Mayo Clinic in Rochester, Minnesota. So I did my 5 years of general. But as I was doing my general surgery, again, I met a great mentor. One of my rotations was in plastic surgery, and I worked with the pediatric plastic surgeon. And he just convinced me that, listen, you want to work with children, work in plastic surgery. It's a great field. So decided to finish up general surgery, and instead of going into cardiac, I ended up in plastic surgery at Mayo in Rochester, finishing up my fellowship in plastic surgery there. I got a call into the chairman's office, and he says, I need you to go see this individual at University of Alabama in Birmingham. And it was Dr. Vasquez. And I said, well, I'm not really interested. He does aesthetic surgery. But I did go down and interview with him, and he was a prince of a gentleman. Again, he's probably my person who I consider my ultimate mentor. But so I ended up doing a cosmetic fellowship in University of Alabama in Birmingham. How I ended up in Jacksonville is my wife was born and raised here. Her entire family's here. So I had an opportunity to come in private practice in Jacksonville. And I was in private practice for about 2 years. And Mayo Clinic asked me to join them. And I joined them. And I've been with Mayo Clinic now for about 20 years.
Well, that's a great story, and just the power of mentors and how they can shape your life and take you in directions that a path that maybe you weren't initially thinking about. And that's a great story. Thanks for sharing that. So, as we mentioned, you're on the Florida Board of Medicine. Tell us, how long you've been in that position, and then share with our audience, what the Board of Medicine does and how it's really important that physicians understand the role of the Board of Medicine as it relates to the practice of medicine in Florida.
Absolutely. I've been fortunate. I've served on the Board of Medicine for the past 8 years, and I've even had the honor of serving as the chair of the Board of Medicine in 2016. And just like most physicians, I had no understanding what the true function of the Board of Medicine was. State medical boards are the agencies that really credential and license medical doctors. They investigate complaints, they discipline physicians who violate the Medical Practice Act, and each Medical Practice Act is specific for the state. So we have one specifically for Florida. We also help physicians for evaluation and rehabilitation when it's appropriate. The mission of most medical boards, and specifically of Florida, is to protect, promote, and improve really the health of the people in all of Florida through an integrated healthcare system from the state, county, and community efforts. Just to give you a little background on the Board of Medicine, in the state of Florida, the medical board is made up of 15 individuals, 12 clinicians, physicians, and then 3 consumer panelists. And those 3 consumer panelists are so valuable to us because they have a different perspective than when we see physicians come forward for disciplinary action. But I think for most of us, the Board of Medicine is a black box, but it really does function in that credentialing process, making sure that we're appropriately licensed, making sure that we are appropriately trained. It really is there to serve and protect the consumers of healthcare and ensure that we are properly licensed. And we also enforce the laws and regulations pertaining to the practice of medicine within Florida.
Well, and it's wonderful to have physicians, really as the body that's overlooking other physicians rather than having non-physicians doing that. I think that's very important. And having people like yourself, it's a lot of work. I know it's a lot of work. Mary Thomas, who's one of our attorneys who works with the Board of Medicine from the FMA's vantage point, has told me how much work goes into it. So thank you for that and your willingness to serve, because it's really, the board's only as good as the people that are willing to give their time to serve.
And you're absolutely right. It is a tremendous amount of work, but it's a tremendous amount of responsibility, because the last thing that I want to do is inappropriately revoke a license for someone who has done nothing wrong. And so I think you have to take that responsibility seriously. And, Mary Thomas is right. It is a lot of work. And I also have to put a plug in for Mary, because she does a great job for the FMA and representing the FMA in front of the board. She's always well prepared when she's bringing material in front of the board.
Good. Well, she's we're very fortunate to have her. So I mentioned that you're also a member of the board of directors of the Federation of State Medical Boards. So tell us a little bit about that organization and what are the emerging issues that the Federation is looking at. So
the Federation is a national voice for state medical boards. It supports them through education, through assessment, data, research, and advocacy. And it provides services and initiatives to make sure that we're promoting patient safety, quality healthcare, and regulatory best practices. Remember, we're in this medical regulatory field, and the Federation represents the 71 state medical and osteopathic boards within the United States, its territories, and the District of Columbia. So again, the Federation really supports the medical boards in their licensing, disciplining, and regulating function. Their goal is still to keep patients safe. Some of the you talked about emerging issues, and many of the emerging issues are still ongoing as we are in this middle of this pandemic. Today's healthcare environment, it's dynamic. It requires healthcare providers and regulators, such as myself being represented on the boards, to be in a continuous mode of learning and adaptation. I think this past year in 2020, one of the big issues was the pandemic. I don't think most state boards were prepared to handle it. So the Federation, since the outset of the COVID-19 crisis, took major steps to coordinate efforts during this pandemic. And some of those efforts including the creation of a work group on emergency preparedness and response. The Federation mobilized data and recovery resources to assist the states in their efforts to quickly increase the healthcare workforce, because we knew that there are some states that were going to need an influx of providers. But how do you appropriately credential them and license them? Well, the Federation keeps track of all the licensed physicians through their physicians data center. So they made it available with free access to every state and every healthcare facility to quickly and accurately verify medical license of any providers, meaning physicians and PAs that were available. They also developed a COVID-19 website with state-by-state details on the licensure waivers, the changes in telehealth requirements, the reimbursement issues. They also made recommendations for increasing medical license portability during COVID-19. So I think what this has taught us is that we need to be able to handle pandemics, because this probably will not be the last pandemic we will ever see.
The lessons learned are critical, because this won't be the last time that we're having to deal with pandemic.
But I think brought some critical issues about how do we get individuals that are appropriate licensed to help in states that they're not licensed to practice in. These waivers that came forward state by state were very helpful in that process. Another issue that's on top of mind for the Federation is physician wellness. The Federation has been working on this issue of physician wellness and burnout since 2016. And in fact, they released a formal policy for the state boards in 2018. That policy essentially encouraged physicians to seek help when they needed it and make sure that the state boards didn't create any stigma when these physicians decided to get additional assistance. We know that COVID-19 has had a profound impact on the well-being of frontline healthcare workers. So I think this has been a critical issue for the Federation to continue providing policies for the state medical boards.
Yeah, and it's going to continue to be a big issue. The mental health piece related to the pandemic is something I think that there's not a lot of reporting on it right now, but it's a huge issue.
Yeah, and we want to make sure that the physicians understand, they can get help without having the fear that they're going to lose their medical license because they've got this crisis that's built around, especially during this COVID-19 time. You were talking about other issues. This is something that's really come up over the past few years with the Federation, and it's the issue of physician sexual misconduct. Last year, the Federation proposed a policy with sweeping recommendations about how to combat sexual misconduct by physicians. And unfortunately, we see some of these cases at the Florida Board of Medicine. I wish we didn't, but they exist. But we created some policies. The Federation created some policies to help boards how they investigate these processes, and also create a public campaign awareness about the necessity for reporting inappropriate physician behavior to the state medical boards.
Well, that's a lot. You to kind of segue into and build on sort of the work that the Federation's doing. You gave a presentation to the FMA Board of Governors recently. That it was a fascinating presentation about artificial intelligence in healthcare. So, tell us a little bit about the latest advancements in AI and what physicians need to know as it relates to liability, licensure, and all of the related topics.
Yeah, and I think AI is moving fast, and it's going to significantly change the healthcare industry. Artificial intelligence is particularly adept at searching large amounts of data and identifying patterns within those numbers. It's really predictions. That's what artificial intelligence is doing, is using data to predict outcomes, to predict diagnoses. I think what we're going to see is that artificial intelligence algorithms are going to take precision medicine to the next level. It's going to increase accuracy and prediction of outcomes, because it's going to mine that large quantities of data that's available in our genetic databases, our clinical databases, our social databases, lifestyle databases. That's what's going to increase our ability to improve our clinical decision support. So AI is going to be there backing physicians, helping them make those decisions clinically. AI is being used in drug development currently. Designer drugs are being used with AI. We're using it to diagnose new diseases. Insurance companies are looking how they analyze their health plans and how they utilize their health plans to help the patients. Health monitoring through remote patient monitoring to improve the outcomes after the patient's been discharged from the hospital. Digital consultations. AI is going to be used in surgical treatments. It's going to be used in managing your medical data and how we can personalize that treatment for that individual patient. I mean, you're going to see AI invade every component of medical care. There's no doubt about that. I think one of the questions you asked were, what are the challenges with the emergence of AI in healthcare? And I think you brought up some key issues, but I think some of the key issues that what I think about and the Federation is thinking is, who is the licensee and who is responsible when an adverse event occurs with AI? I mean, I think this is a question that's going to be difficult to answer. But, if a physician's utilizing an AI system and for some reason the system creates an error, or the physician decides not to use the recommendation for an AI system, who's responsible? Is it the physician? Is it the device manufacturer? Is it the healthcare organization that says, you're our employee as a physician, you need to use this device when you're seeing patients? Is it the software developer? Or maybe there's problems with the data that was used in that software. So it may be the input data host that's responsible. I think the second key concern surrounding AI is the issues surrounding the data used in the artificial intelligence algorithms. As AI becomes incorporated in some of these healthcare devices, some of the fundamental questions include, who owns that data? Okay. Is it the patient? Is it the software developer? Is it the healthcare organization? And I think ideally, in my opinion, the patient should own their healthcare data. Right now, physicians own healthcare records, but the patient actually owns that data. Other issues surrounding data is there bias in the data? So if an algorithm is based on a health system, let's say Mayo, but we have a very different patient population than, let's say, a county hospital does or a rural hospital does. So you can't use that algorithm in a similar manner as you would at each of those hospitals. So we have to be very careful of the biases in the data. The other thing is privacy and security. How secure is your data within those databases, whether it's genetic, whether it's in the radiology databases? Also, I think the other challenge, or one of the things that we have to consider as state regulators, is what are the public expectations of artificial intelligence? Well, I can tell you, patients expect their data to be utilized in a responsible manner. Okay, they want to know that their data is safe, it's private, it's secure, and they want to know that the physician that's using their data in an algorithm, they want to know that physician understands that algorithm that's used in that AI device. I guess the short of it is the algorithm should be explainable to the patient. Most importantly, the patients expect reliability and safety in any AI device. And it's interesting, I think patients expect a machine to be perfect, but they'll give some latitude to the physician if they're imperfect. The FSMB, the Federation strategy around the AI right now, is to make sure that any AI device is safe for patients, and that it's not sacrificed in any manner, in any modality. We want to regulate for the technology, not at the technology. We want to make sure that the technology can be utilized appropriately. We don't want to hamper development of that technology. Does that answer your question, Tim?
No, it does, and I think that this is coming fast, and we're fortunate there are people that are looking at the implications because they are broad, and I'm glad that the Federation is taking this as a goal and has strategies that are developed because it's coming. And the other thing is what happens. There was a 60 Minutes episode recently, I don't know if you saw it, about China and their focus on AI and how they're looking to really be a influence all over the world and in the United States, and they're going after data wherever they can get data and capturing data, and that's the the key to being able to develop, as you said, these algorithms and so forth. So, what are the implications when you have foreign countries that are playing in this space?
Well, it's interesting you bring this up about the whole question of data, and we're getting data from multiple areas. I mean, think about it. Most people wear a lot of wearables. That's creating data. People are using Facebook. That's creating data. People are using Instagram. That's creating data. You go to your healthcare system. Your EMR is full of data. The radiology has data. It's incredible the amount of data that's out there. And right now, much of this data is what we call unstructured. And so you can't use one data from one point to another. It has to be structured so we can really gather that data and make sure that it's understandable across all points. But it is a concern when you have technology companies or even foreign countries that have access to data that they don't own. And I think this is where we have to really say that the patient owns that data.
Yeah, and I think probably the education piece that needs to take place is really with patients and with just the general population. Just know that you have all of this data, and somewhere somebody is aggregating all of that data, and so it's fascinating. It's a little scary, but it's also promising, because if used correctly, we could be looking at extending people's lives and developing, as you said, personalized treatment to the level that we haven't been able to do so far.
Yeah, and I think we're going to see such an advancement in healthcare, both in accuracy, patient safety, and quality and outcomes. I think AI is going to help us do that. We just have to do it correctly.
Yeah, absolutely. Well, the FMA is fortunate to have you serving on our board of governors, and you have now for a number of years. I was interested in your thoughts about, you talked about when you were on the board of medicine, you had a whole new sort of appreciation for the board of medicine, having served on it. And I'm wondering, having served on the FMA board now for a few years, how has that shaped your views towards organized medicine and the FMA's mission really to help physicians practice medicine?
Well, I can tell you, being on the board of, I think, for the FMA for the past 3 years, it's really highlighted the importance of an organization like the FMA in providing a really significant voice for the practicing physicians of Florida. Whether you're in private practice or you're part of an organization like myself, I mean, the FMA is fighting for every physician here in Florida. I would highly recommend that every physician in Florida, they should attend an FMA annual meeting, and they will truly understand the value and the significant effort that the FMA puts forth daily in an effort to protect the physicians as they practice medicine. I think what I've learned, how significant this organization is regarding the change from private practice to organized medicine, has been absolutely phenomenal. The FMA has significant advocacy efforts and resources to help every Florida physician. I can tell you, we're all part of national organizations, but it's those organizations that are closer to where you're
Sure.
working that are really providing the help that you need. And FMA truly advocates for the patients and for the physicians of Florida.
Well, we always say, it's important for physicians to be part of their specialty society, certainly. And during my time in organized medicine, I've noticed that, physicians do identify first and foremost with their specialty, but it's also important to be part of the broader organization. And the FMA is really an umbrella organization that represents all physicians, no matter what their specialty is. And as you mentioned, no matter if they're in private practice, independent, or with a large group, employed physicians, it's important that everybody's voice be represented. And So hopefully, we're a work in progress. We're only as good as the people that we have working with us, and we're fortunate to have you and many other physicians that dedicate their time to the organization and bring so much to the table. So thank you for that. Any other comments? We really appreciate your time. This AI topic, I think we just really scratched the surface, but I think it's important that physicians understand how this impacts them and their patients going forward.
Well, I think we're going to see dramatic changes within healthcare using AI. But I think as physicians, we don't need to fear that change. Actually, it's going to improve overall healthcare. I think physicians will have to embrace it, just like any new technology. I don't think you have to be the expert in AI, but just know the general aspects of AI as it moves forward. It really is going to change how we practice in the future.
Well, very good. Thank you, Dr. TerKonda. We really appreciate you spending some time with us today.
Thanks, Tim. I really appreciate the opportunity.
Great.
Florida Medical Association, helping physicians practice medicine.